The primary purpose of the respiratory system is gas exchange. This involves the transfer of oxygen and carbon dioxide between the atmosphere and the blood. While adequate perfusion is needed to distribute oxygen to the body's tissues, adequate oxygenation depends on a healthy, functioning respiratory system. Harding et al., 2020, page 455. For the process of inhaling, the respiratory muscles, oral space, lungs, and alveoli are essential for ventilation, perfusion, and the exchange of respiratory gases. Potter et al., 2020, page 912. The diaphragm moves downwards, and external intercostal muscles contract, moving outward, to create a decrease in the pleural pressure, which then increases the size of the thoracic cavity. As the lungs inflate, air moves in and out of the lungs because interthoracic pressure, which is when gas flows from high pressure, which is the atmosphere, to low pressure inside the body. As for the process of exhaling, the relaxation of the diaphragm and contraction of the intercostal muscles allow air to escape from the lungs. Potter et al., 2020, page 912. With little to no muscular effort required, exhaling is a passive process that relies on the lungs' elastic recoil abilities. Exacerbation of asthma or chronic obstruction pulmonary disease, COPD, cause expiration to become active. Labor process, relying on muscles to help expel air during labored breathing. Harder et al., 2020, page 458. Age, gender, and height all determines one's normal lung volume. Individuals have different lung capacity because conditions or diseases that change the structure or function of the pulmonary system alter respiration. Some of these conditions include COPD, asthma, lung cancer, and cystic fibrosis. Potter et al., 2020, page 912. Other alterations in one's health can cause a variation in lung capacity. Includes pregnancy, being athletic, obesity, obstructive and restrictive conditions of the lungs, such as respiratory diseases, smokers, and those who live in high climates. Asthma is a chronic lung disease that is caused by inflammation of the airways, and it obstructs the airflow because the airways overreact to common stimuli with bronchospasm, swelling, and the production of thick mucus. The inflammation causes bronchoconstriction, airway hyperresponsiveness, and airway edema. Ventilation perfusion anomalies occur in the lungs during the asthma episode as a result of reduced alveolar perfusion and ventilation, as well as elevated alveolar gas pressure. Due to hyperventilation, there will be a decrease in carbon dioxide in the arterial blood and increased pH, resulting in respiratory alkalosis. But as airflow worsens, the carbon dioxide in the arterial blood will increase, causing respiratory alkalosis, which is a sign of respiratory failure. The effects on the lungs can include wheezing, breathlessness, chest tightness, and cough. Harding et al., 2020, page 452. Due to this respiratory illness that can be life-threatening, the priority would be improving ventilation, correct hypoxemia, treat exacerbation, and maintaining control of the disease. The major drugs for asthma are anti-inflammatory agents and bronchodilators. Bronchodilators are the beta-2 antagonists, and the anti-inflammatory drugs are the glucocorticoids. Glucocorticoids are a scheduled medication, whereas beta-2 antagonists may be administered on a fixed schedule for long-term control, or PRN, to manage acute attack. Like the glucocorticoids, Beta-2 antagonists are usually inhaled. Bertram and Rosenthal, 2018, page 926. For short-acting beta-2 antagonists, albuterol is used, but those who need long-term control would take fluticasone. The nurse should provide the patient with rescue medication during the episode. Assess the patient by auscultating the lungs, monitoring the patient's heart rate, respiratory rate, blood pressure, pulse ox, and peak flow. Another important intervention is keeping the patient calm by reducing the sense of panic. Education about asthma is important, and the ways to minimize the symptoms and prevent exacerbation. The nurse should explain how the lungs work, what asthma is, the signs and symptoms related to asthma, the risk factors and triggers for asthma can be hereditary or environmental. Asthma can be triggered by exercising, obesity, air pollutants such as pollution, cigarette smoke, and perfumes. Allergens such as animal dander, mold, and pollens. Other triggers of asthma can include drugs, especially NSAIDs, GERD, stress, emotional expressives such as crying or fear, which can cause hyperventilation, farming plants, wood, dust, allergenic rhinitis, and viral respiratory tract infections can cause an asthma attack. Encouraging exercise within limits, techniques to decrease anxiety, healthy diet, and plenty of fluids will minimize an asthma attack. The nurse should teach the patient about their medication regimen and the importance of following it. The nurse should perform teach-back on the correct use of inhalers, spacers, and nebulizers, as well as breathing techniques and their asthma control plan. Community resources that are available to patients with asthma through the CDC website are the National Heart, Lung, and Blood Institutes, U.S. Environmental Protection Agency, Allergy and Asthma Network, American Academy of Pediatrics, American Lung Association, and the Asthma and Allergy Foundation of America. Thank you.